Hello, I'm Dr. Bob Barish, and welcome to another edition of UI Health News. So today we are featuring the UIC Urban Health Program and its Executive Director, Dr. Darryl Pendleton. So thank you for joining us, Dr. Pendleton. And first tell us, what is UHP and what's its role at UIC?
Thank you, Dr. Barish. UHP collaborates with partners both on and off campus to provide opportunities to underrepresented minority students. Underrepresented minority students are individuals from populations who have historically been underrepresented in our health science careers. UHP is a pipeline program, and the pipeline extends from middle school to high school to undergraduate programs into our health science colleges. And UHP provides programming at all levels of the pipeline. We provide two types of program: career awareness programming and academic enrichment programming. For instance, a middle school student would experience academic enrichment programming through our early outreach programming, which strengthens their academic skills. A high school student would experience career awareness programming that exposes them to careers in health. A good example of this type of programming is the work that's being done at the College of Pharmacy, where they're taking high school students and placing those students in local pharmacies with pharmacists. Once a student enrolls at UIC, either as an undergraduate student or as a health profession student, they receive programming such as mentoring, tutoring, and professional development.
We know you had an incredible event, your 40th anniversary, the UHP Gala. So tell us a little bit about that.
Yes, in September, UHP celebrated 40 years of providing opportunities for students. It's ironic that earlier this month, we took time to pause and acknowledge the life and legacy of Dr. Martin Luther King. It was Dr. Martin Luther King's visit to Chicago in the 1960s that led to the creation of programs such as the UHP and others like it at the university. Back in 1978, local politicians, community activists, healthcare providers, the Illinois Board of Higher Education, as well as the university, collaborated to create UHP. At that time, the focus was on the College of Medicine and medical students. Now, UHP is interdisciplinary, works with faculty, staff, as well as students. We produce clinicians as well as researchers. Since the inception of the program, over 7,000 students have graduated from the UIC Health Science Colleges. Many of them are still serving in the state, addressing health disparities and health inequities. In fact, a recent AAMC report highlighted that UIC, over a 35-year period, ranked third in the nation in terms of producing African American physicians. UHP has had an impact on our state, our university, and the lives of many.
Well, that is something that we should all be very, very proud of. I'm not sure everybody knew of that statistic, that in the past 35 years we're number 3 in graduating African American physicians. So congratulations to all involved. We know you have a lot of work to do to keep this going. And again, kudos to your staff, to everybody who's involved in this program. We look forward to more great things happening. And I know now, I think we're going to have a video of some of the highlights of the 40th anniversary of UHP.
Good evening, everyone, and welcome to the University of Illinois at Chicago's Urban Health Program's 40th Anniversary Gala. Tonight, we celebrate our past achievements. We also look forward to many more inspiring celebrations of success, one student at a time.
Devana and students like her is what this evening is all about and what this program is all about. Encouraging minority students in the health sciences area. It's such a great program, it's such a great need, and UIC has been right at the forefront of helping to meet that tremendous need now for 40 years. People like me were the first to reap the benefits of the great civil rights movement, the first to reap the benefits of Montgomery and Birmingham and Selma. It is something that I have never forgotten. And as that movement was happening, programs like this one were being established to meet this incredible need, to move into that medical pipeline, whether you're studying medicine or dentistry or pharmacy or some of the allied health fields. The impact that this program has made is tremendous. It can be seen in communities, it can be counted in changed lives, it can be counted in lives saved. How many programs can make that statement?
I'm a K-Town West Side kid. I remember in 1966 when Martin Luther King lived on the West Side on 16th and Hamlin. And when he left Chicago, I think it spurred our community into a fight mode. There were so many people that took up the mantle and decided that they were going to improve the conditions here. 10 years ago, when we celebrated 30th anniversary of the Urban Health Program, many of you were in attendance then. How proud we were to know we had graduated nearly 5,000 Urban Health Program students. And now, 10 years later, looking backward as we look forward, celebrating 40 years of success and graduating over 7,000 strong.
Addressing health disparities and the underrepresentation of minority groups in the health professions is so vital to the well-being of our community. The programs and initiatives that you have started over the past 40 years are making a great contribution to undoing the health disparities in our communities.
The future of our achievers is our legacy, our mission, and our vision. Our achievers have collaboration, curiosity, engagement with their peers, tell stories, listen to stories, and have ideas.
I often say that health is wealth, and it's one of the most important elements of living. You can have everything else in the world that there is. You can have all of the money. You can have all of the prestige. You can have as much knowledge as you can acquire. But if you're not feeling well, if your corns are hurting, if you've got a headache, you are missing the quality of life that you'd like to be able to enjoy. I congratulate the Urban Health Program. As a result of it, the University of Illinois has been an absolute leader in providing opportunities for minority students in this country to get trained, educated, and develop opportunities in healthcare.
On behalf of the Urban Health Program, we would like to thank you wholeheartedly for joining us this evening as we look backward to move forward.